Hello, my name is Dr. Sue McGladdery. I'm the Medical Director from First Med Centres in Budapest, Hungary, and I'd like to talk briefly about colic. This is something that occurs in almost all babies. Colic or infantile colic is the condition when crying lasts for more than 3 hours per day and is not due to a medical problem such as a hernia or infection. It typically starts at around 3 weeks of age with a peak at 4 to 6 weeks of age. Fortunately, it usually passes by 12 weeks, hence the name 3-month colic. It usually starts at the end of a long day and the baby begins in a regular way to scream every evening, often at the same time. There's sudden onset with the legs drawn up, and the screaming may last minutes or even hours. Typically it settles when the baby is exhausted, sometimes after passing gas or stool. It's very tough on parents and causes a lot of anxiety, frustration and exhaustion at a time when caring for a small baby is already very demanding. Colicky infants usually eat well and gain weight normally. What's the cause of this problem? It seems to be an unusual sensitivity to stimulation with possible triggers like increased intestinal gas, hunger or overfeeding. Some breastfed babies are also intolerant of foods that are in the mother's diets. Bottle-fed babies, on the other hand, may be intolerant of proteins in the formula milk. Sometimes things like fear, frustration or just excitement can lead to worse problems of colic. How is it diagnosed? Usually just on the basis of the history, but a careful physical examination of the baby is necessary at the onset to exclude other problems. Sometimes colicky pains can be due to problems such as hernia or intussusception, maybe a hair tourniquet on one of the fingers, or a problem such as an ear infection. What about the treatment of this condition? Sometimes it can be quite frustrating to find something that will soothe the baby, and you need to try and see what works best for you and your baby. Things that often work include swaddling or rocking the baby, cuddling or massaging, holding in an upright position or offering a pacifier. Also, simple things like singing a lullaby can be very soothing for the baby. You need to talk to your doctor about possible medications that you could use to help with this problem, such as simethicone drops. The good news is that colic is a benign condition. The baby usually grows out of it by around 3 months of age. But you always need to call your doctor if you're concerned. It's very important in such a young child not to miss a serious condition. If your baby's crying pattern or behaviour changes suddenly, for example, crying associated with fever or forceful vomiting, diarrhoea or bloody stools, that can indicate a much more serious problem and you need to see your doctor urgently.